All right, and welcome back everyone to another episode of the 40 Under 40 Public Health Catalyst Award winner interviews. We have another winner with us today, Jennifer Mandelbaum. Did I say that correctly, Jennifer?
You're close. It's Mandelbaum.
Mandelbaum. My apologies.
No
Um,
worries.
yeah, so this episode is designed to really get to know our 40 Under 40 winners. There are a number of different researchers, politicians, authors, consultants, and public health practitioners in all different stripes from all over the world. And so we'll get to learn a little bit more about Jennifer today. Jennifer, I'm not going to take away your thunder. Feel free to introduce yourself to the audience.
Sure. Hi, everyone. I'm Jennifer Mandelbaum. I'm a public health researcher, educator, and policymaker. So my day job is working for Athena Health, which is a health tech company based in Boston. I lead I lead survey and qualitative research for them, just studying kind of the biggest trends in health and healthcare. And I love doing that work. I also teach an intro community health class at Tufts University. And as of last Wednesday, I am a member of the New Hampshire House of Representatives.
Oh,
So,
excellent.
yeah, so kind of bringing that policy piece into it as well.
Okay, perfect. So you are incredibly eclectic. One of our most eclectic ones, I think, of this 40 under 40 cohort, researcher, educator, policymaker in the New Hampshire House of Representatives. Jennifer, can you tell us a little bit more about your journey? How did you become to be, I guess, so eclectic, a hybrid, if you will, a public health practitioner?
Sure. So, my parents both worked in healthcare, and my dad and brother had chronic health conditions. So growing up, kind of health and medicine were dinner table conversation. And I always thought I would do something kind of clinical, maybe, or kind of on the business side of healthcare. And then I got to college and I took a class called the American Healthcare System that was taught by Stuart Altman, who was very involved with the Clinton administration's health initiatives. And just that was where I was first introduced to the term public health and really fell in love with the idea that we can make change at a population level, or at least try to. So from there, I got my master's and my PhD in health education and behavior. And I had worked for a state health department in South Carolina and thought that was a really great experience in governmental public health. I was looking to switch things up and do something in industry after finishing my doctorate. So I started off working for Optum, which is the kind of the behavioral health branch of United Health Group. And then about 6 months ago, started my job at Athena. So I love that I get to do research and I get to study kind of what's going on in the world of healthcare. And then I'm working for this really innovative tech company. Teaching was something I really enjoyed doing when I was working on my PhD. I really enjoy working with first and second year college students who maybe aren't quite jaded about the world yet and are just so eager to learn. And it just kind of allows me to tap into like a different piece of my background. So I knew I didn't want to stay in academia, but wanted some sort of connection to it. So teaching this class every semester has been a great way to do that. And then politics also just kind of fell into my lap. I um, collaborated with a nonprofit up here in New Hampshire called 603 Forward that works to get younger folks involved in their communities, whether that's through volunteering or joining a board or committee or even running for office. And I worked with them on an event last summer about the housing crisis on New Hampshire's seacoast where I live. And I focused what I spoke about um, on public health and how um, people's health and well-being depend a lot upon having safe, stable housing. And I stayed in touch with them in the month that followed, and they emailed me a few months ago to say that the representative for my district was stepping down. Would I be interested in running? And I said, sure. And here we are. Um,
Wow.
3 close to 4 months later. So it's definitely a steep learning curve. I did not have any political ambitions, but I thought I'll give this a try and love that will hopefully over time be able to bring my public health expertise to our policies.
Wow, that is amazing. Congratulations again. And just an interesting
So,
way that that happened, like the serendipity, and then you just being very open to say, let's go ahead and give it a shot.
yeah.
So much to, I think, unpack there. I mean, just it sounds like you being very open to public health and healthcare in the way that it formed, parcels out in terms of business and entrepreneurship, wanting to stay connected to academia, but then also like having those political ambitions. I'm curious, Jennifer, like from your experience so far, how many people within, the New Hampshire House of Representatives or even like in other um, areas like have that public health background?
Yeah, I'm not quite sure. I think it's a pretty small percentage. We do have a few physicians in the House of Representatives and other healthcare providers. I actually sit behind a nurse. She's Representative Paige Bushemin from Nashua. On Thursday, which is the first House session I attended, she like kept turning back to me and she was like, "We're gonna do some awesome stuff here." Um, but yeah, I mean, I think folks with experience in healthcare are kind of a minority in in at least the New Hampshire state legislature. So um, yeah, I really hope that having that background can be useful.
Absolutely. And I think that can segue into our next question. From your perspective, what are some of the more pressing public health and or social justice issues?
Yeah, I mean, the first thing that comes to mind for me is abortion. I think, um, I share similar views as the AMA and APHA that abortion is healthcare. And we see what happens when women and other pregnant people can't access, medically, either. Kind of medically called for abortions when their life is in danger or their fetus has some sort of anomaly that's going to result in a painful death, or even when someone just has an unwanted pregnancy. I don't think there should be any judgment in why someone chooses to have an abortion.
Mhm.
Um, and I think bodily autonomy is really important. And um, so that kind of stands out to me as kind of one of the biggest public health and social justice issues of our time, and certainly something that affects folks with fewer resources or who might be of a racial ethnic minority group to a greater extent than a lot of higher um, higher income um, or folks with more resources. So um, yeah, I think that's a big one, and we see what effect the Dobbs decision in the Supreme Court had overturning Roe v. Wade, and then also what's happening at kind of at the state level too. So one of the things that's on the mind of a lot of the Democratic lawmakers in the New Hampshire House is that we have some of the more restrictive abortion policies in New England, and I think
Mhm.
our policy is still it's a lot less restrictive than other states. It's a pretty long term limit for an abortion, but um, the idea that our state legislators could be kind of chipping away at that when there's no right to an abortion in our state constitution really concerns me.
Wow, wow, that's very interesting. Yeah, I think abortion and its links to sexual and reproductive health for
Mhm.
Birthing persons is absolutely critical. Very interesting. And if we switch gears just a little bit, so you do research as well, as part of your job. So tell me more about like what some of the most inspiring research projects that you've been working on or that you're most excited about.
Yeah, so I'm really excited because we just got the results of our third annual physician sentiment survey back. And this is a nationally representative study of about 1,000 physicians in the US. And we ask them questions about topics ranging from burnout to AI and interoperability. Really just trying to get a sense of like what are the biggest factors shaping physicians' views on healthcare and in the healthcare industry,
Mhm.
and what are some of the ways that we might be able to address that. Um, and this being the third survey, I think being able to compare some of the questions over time is going to be really interesting. So don't have too much to share in terms of results yet, but I am working on some projects around connectivity and interoperability. And then I think there are going to be some really neat findings around AI. We've found from kind of preliminary analysis so far that um, a lot of physicians think that AI has potential to solve some of the issues they're facing, whether that's a lot of patient communication or administrative burdens. But a lot of physicians are really hesitant about AI because they don't want to lose that kind of human touch. So I think just given how fast AI and technology in healthcare is evolving, I think it's good that we've kind of taken a beat and we've got this kind of cross section of physicians in time to try to understand what it is that they're thinking about these changes that are coming up the pike.
Yeah, absolutely. As a physician myself, I'm very fascinated to see exactly what this survey will show. Burnout, AI, as you said, interoperability and connectivity. And it's very interesting. And I have a bias where I think that, the physicians, my colleagues that I speak to probably think one kind of way, but I don't know, like how does that how that may differ from different regions across the country. I love that you're doing that. I'm curious. Are there other surveys like this? Because I know it's very difficult to get 1,000 physicians to do anything. So other surveys that are similar to this, or kind of like what really brought this survey about?
Mhm. Yeah, so I think our survey is fairly unique. As you mentioned, it can be hard to get so many physicians to respond to surveys. And I think one thing that really makes this survey valuable is that we're not just surveying our customers, the folks who are using Athena Health's products. We're really getting kind of a cross section of all US physicians, and getting information about such a wide range of you know applicable topics. So I think that the data we collect from the survey, it's the third time we're doing it, um, are pretty unique. And for anyone who's interested, you can always do an online search for Athena Health Physician Sentiment Survey, and you can find um, uh, very nicely formatted documents from our surveys from 2021 and 2022. And then this latest version, we have some press releases out about. So I encourage folks who are interested to take a look.
Absolutely. I'm just going to reiterate that for you again as well. So Athena Physician Sentiment Survey, and lots of different wonderful downloadable goodies. I'm curious, given also the political climate with DEIJ, so diversity, equity, inclusion, and justice, was that something within the survey as well, given that that's such a hot topic these days?
I don't believe it was. I'd have to check on that. But yeah, I mean, I think either way, whether it's, in the survey and we have some insight into that, or if it's not, and kind of wondering why it might not be. Um, yeah, I think that's a great question. And um, I mean, if it wasn't in this past year survey, I think it would definitely be something I'd advocate for in future iterations.
Yeah, I just think of the state of the physician workforce and all of the, the multiple workforces within healthcare, nursing, other techs, et cetera. And basically like there's a shortage across the board, overall, right? In terms of numbers, but then in terms of representation from a number of racial, ethnic, sexual, gender, diversity groups. So just very curious. Does Athena do this survey like on an annual basis, or is it kind of more every couple of years?
We've been doing this on an annual basis. Just given the timing of data collection for this most recent survey, we're referring to it as our 2023-2024 survey, but I believe our plans are to field another survey towards the end of 24.
Awesome. Well, now I'm gonna like follow that because I'm very curious. But I'll switch gears again, Jennifer, because there's still lots I wanted to cover in a shorter period of time. Tell me more about the work that you're doing in academia. I guess anything new or interesting there.
Sure. So, like I mentioned, I teach an intro to community health class at Tufts University in Medford, Massachusetts. And um, one thing I've really picked up on is that a lot of students are interested in research opportunities or really eager to do internships very early on in their undergraduate careers, which as a public health person, I think is great. Um, but I was not that on top of it when I was a freshman or a sophomore.
Mhm.
I also have noticed that there are a lot of students who really want to get involved in social justice work or advocacy. And so I've tried to point out ways that if students want to get more involved around a particular issue within public health, here are ways you might be able to do that. I also really try to make our assignments a little bit more kind of based in on kind of real world activities, like when you're working in public health, unless you're working in academia, you're not writing term papers. So I have students practice giving presentations and putting together a poster and writing op-eds, really trying to get them to engage in different mediums so that whether they continue in public health or not, they have those skills that they can, bring to whatever it is that they're doing.
I absolutely love that. I couldn't agree more because I feel public health continues to be, yes, very much term papers, or if you're doing a quantitative track, then those particular tests.
Mhm.
But I love that. BCPH, we always love interns. We always have space for new interns in a number of different areas. So I will put that out there to you, Jennifer, and to the audience as well.
Absolutely. No,
So
thank
we
you. I've gotten a lot of questions from former students recently about internships and try to point them in some directions, but yes, it will definitely point them toward BCPH.
Yeah, and I think our greatest thing beyond just being a public health institution is that we are remote, and we found many students like that. They like having that remote internship possibility. Um, Jennifer, what does the 40 under 40 Public Health Catalyst Award mean to you?
Um, I just think it's a really nice recognition of the work I'm doing to advance public health and health equity. Um, I really feel honored to be included on the list uh, and included among such accomplished young professionals. I love how we each have approached public health from different angles and work in different settings, but are still very passionate about health equity and public health. So yeah, for me, it feels kind of validating. So yeah, I appreciate the honor.
Awesome. Great. Well, that's definitely one of the reasons why, we created the award to be able to, because basically compete with people following like the Forbes 30 under 30 or the Forbes 40 under 40, which I don't feel has a very distinct public health recognition. So we really wanted to fill that gap. So sorry, Forbes. Um,
I
when
also
thinking
see a lot of like 30 under 30 things and like I did nothing before I was 30. Like Um, yeah,
Mhm.
I like that there's a little bit more time for some of these accolades.
Yes, absolutely. So you're doing a lot, very interesting things. Can you give us a sneak peek into like some of your ambitions, like that you'd like to accomplish in public health, in politics, or with your research, etc.?
Yeah, I feel like I've had a lot of transitions over the last few years in terms of transitioning out of grad school and working for a year at one company, then starting a new job and teaching, and now this new role in politics. So I'm looking forward to just kind of settling into these different roles, and for a bit, and not necessarily reaching toward that next rung or accolade. I would really love to get some more advice and input around my teaching to make sure that it's really engaging students most effectively. I would love to be able to share the research I'm doing with my colleagues at Athena in different ways. So I'm used to academic publishing, but also thinking about how we can put together blog posts and white papers and make sure that different audiences can see what we're doing and use that work to inform their own research or practice. And then thinking ahead in terms of politics, I just joined the House, so um, I feel like my head is spinning from our first session on Tuesday, but definitely looking forward to getting to know more of my fellow lawmakers. I really believe that bipartisanship is the way to get things done. So I would love uh, to co-sponsor and at some point kind of be the lead on a bill for something related to public health.
Awesome, excellent. And would that be in the area, as you mentioned earlier, like abortion or reproductive health or sexual health for birthing persons, or?
It might be. I I think there have been some interesting policies that have popped up in the legislature recently. There was legislation around like clarifying what evidence-based means, and a bill just passed that would ban schools from having a mask mandate. So the if we had another pandemic, schools could choose not to have a mask mandate. And I'm not sure kind of how that works in terms of like separation of powers, and could the state mandate something differently. Um, but I think in some ways we're kind of seeing a little bit of an erosion of um, of 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 trust and reliance on public health experts. And so whether that's whether I would do something around reproductive rights or sexual and reproductive health or something different, um, I really want to make sure it's something um, that will have a meaningful, will make a meaningful difference in people's lives.
Absolutely. I love that. And all I can think of is like just of, so you did your MPH at Yale. And I just think about like all of the places that put out, public health practitioners. And there, I feel like so many of us that we need to be able to embed ourselves in like all different areas, especially politics where it sounds like underrepresented.
Yeah.
Jennifer, as the last question, if you could give advice for people who are just starting their public health career, are interested in social justice, or really are inspired by your own path, what advice would you give them?
Oh, can I give two pieces of advice?
You can give as many as you want.
Okay. So I think one thing is to have multiple mentors. So this was something Dr. Heather Brandt's at St. Jude's Children's Research Hospital instilled at me while I was doing my PhD, that the person you go to for advice about statistics is not necessarily the same person you're going to go to for interviewing tips. So having kind of a team of mentors or like a kitchen cabinet of folks that you can go to, I think is crucial at any stage of your career development. And then for folks who um, have uh, any measure of interest in politics, or even just kind of exploring how policies make their way into practice. I think a lot of what I figured out that a lot of kind of a lot of that process is just showing up. So whether that's going to your local town hall or city council meetings and speaking on an issue that's important to you, or writing an op-ed, or in I'm not sure how it works in other states, but in New Hampshire, you can submit testimony online about different policies in the House and Senate. So all those little things really help, because I'm finding that unless people tell me that something is an issue or something's going really well, I don't know that.
Mm.
So definitely don't be afraid to get involved in whatever way feels comfortable to you in terms of civic engagement in your local community. I think that what's happening at kind of the country or international level is definitely important too. But kind of at that city or state level is where those tend to be the things that are going to have the greatest impact on your day-to-day life. If when it comes to things like clean drinking water or building resilience to climate change, those are all kind of local or state issues.
Hmm. Wow, I love that. Yeah, the first one resonates a lot with me, the panoply of mentors, or the kitchen cabinet of mentors. I agree. Don't go to your former stats professor for interviewing advice. May not
I
may
mean,
not
it
be.
could be the same person. But yeah, just kind of figure out, who the right person is at any given time to speak to.
Yeah, absolutely. And I learned something because I did not realize that one could submit online testimonials to your government. So that's great. I'm going to
At
definitely
least
tap.
in New Hampshire, I think it's worth checking if other states allow that.
Yeah, absolutely. Or at least advocating, being here in California, I would say New Hampshire's doing it. We need to do it too. Is there anything else that we may not have covered that you wanted to bring out before we ended, Jennifer?
Oh, I don't think so. I think we covered a lot of ground. But I mean, I think getting involved in organizations like BCPH or the American Public Health Association, can be really, really beneficial. And I guess for students and young professionals out there too, I'll also add kind of speaking to people within the field, grabbing a coffee with someone who might be a year ahead of you in school, um, or kind of reaching out to a shared connection on LinkedIn to have a quick call about what they're doing. I found that tend to be pretty generous with their time and expertise. So don't be afraid to reach out and take advantage of that.
Awesome, awesome. Well, thank you so much for this interview, Jennifer. I definitely learned a few interesting things, and I imagine the audience has been inspired by your particular journey. Very, very unique, fascinating journey. So, everyone, thank you so much. Feel free to tune in to another episode of the 40 Under 40 coming up soon. And if you want to learn more about Jennifer, feel free to go to bcph.org and connect with her via LinkedIn or in other regards. Thank you again so much, Jennifer.
Thank you so much. This is fun.